Common postural deformities: knock-knee, bow legs, flat foot, round shoulders, lordosis, kyphosis, and scoliosis, and their corrective measures. Special consideration: menarche and menstrual dysfunction, female athletes, triad, osteoporosis, amenorrhea, eating disorders. Posture. The posture is termed as in which the body is so balanced as to produce least fatigue. It means balancing the body in accurate and proper manner while sitting, standing, etc., or during any other actions. Importance: A. One's personality can be judged. B. Better balance, agility, and overall physical performance. C. Helps in maintaining proper manner of standing, sitting, walking of one's body. D. It is a measure of one's alertness. E. Has better alignment, which translates into less injury. F. Recovers quicker from exercise or physical exertion, and feels more energetic. Common postural deformities: knock-knee, flat foot, round shoulders, kyphosis, lordosis, scoliosis, bow legs. Causes of poor posture: I. Injury: when bone, ligament, or muscle is injured, it weakens the support to that. 2. Disease causes the joints to lose their strength and mobility. 3. Heredity deformities like kyphosis and flat foot are sometimes due to hereditary factors. 4. Overload, overwork, or fatigue also results in poor posture. Lack of exercise. The maintenance of erect posture requires strength and endurance. Acquired congenital deformity. Causes: lack of balanced diet, obesity, deficiency of vitamin D, calcium and phosphorus, rickets, early age, walk standing due to flat foot, carrying heavy weights at early age, for long time, malnutrition. Bending of legs inward direction, and knees strike each other while walking or running. Precautions: take balanced diet. Do not force babies to walk at very early age. Perform proper exercises. Horse riding, best exercise: Padmasana, Gomukhasana, standing with pillow between the knee for some time. Use walking caliper. Straight leg lift, straight leg, knee press on the towel placed under the knee. Side kicking the football. Use cod liver oil. Bow legs. Causes: enlargement of lateral ligament of both knee quickly as compared to medial ligament. Weakness of bones and muscle. Long time cross-leg sitting. Faulty style of walking. Obesity, rickets, early age, standing and walking. Bending of legs in outward direction normally occurs during childhood. Normal bow legs. Symptoms: gap between the knees are increased, knee moves in outward direction in standing, walking and running. Shape of legs look like the bow. Precautions: take balanced diet. Do not force babies to walk at very early age. No deficiency of vitamin D, calcium and phosphorus in the diet. Corrective remedial measures for bow legs. Give balanced diet enriched with calcium, phosphorus and vitamin D. Walking, feet twisted inward. Use of walking calipers. Massage therapy. Use those exercise which strengthen the muscles surrounding the knee, such as leg extension in laying position. Pilate exercise such as roll-up and ballerina arms are effective to tone legs. Garud Asana, Ardhmatsendrasana, Ardhchakrasana, Gomukhasana. Flat foot. Disappearing the arc of the foot causes weakness of muscles and bones. Overweight and obesity. Standing for a long time, carrying heavy load for long time. Injuries: malnutrition, improper shoes. Not doing any exercise. Symptoms: pain in mid part of feet during standing and walking. Disappearing the long arch of the feet. Complete feet print can be seen on the floor. Precautions: use shoes of proper size and shape. Don't walk barefoot for long duration. Don't enforce babies to walk at very early stage. High heel shoes should be avoided. Carrying heavy weight at early age should be avoided. Symptoms: pain in mid part of feet during standing and walking. Disappearing the long arch of the feet. Complete feet print can be seen on the floor. Precautions: use shoes of proper size and shape. Don't walk barefoot for long duration. Don't enforce babies to walk at very early stage. High heel shoes should be avoided. Carrying heavy weight at early age should be avoided. Corrective remedial measures for flat foot. Riding with legs, walking or running on the sand. Walking on inner and outside of feet. Regular running, jumping with skipping rope onto. Wearing good quality shoes. Pick the pebble with help of feet. Tadasana, Vajrasana, ball under the feet. Game, wear the shoe with hanky inside the mid part of the feet. Shoulders become round and tilt in the forward direction, giving a rounded form to the upper part of the back, and the head is extended with the chin pointing forward. Causes: heredity, wearing tight clothes, sitting on improper furniture, wrong habit of sitting, standing, carrying heavy load on shoulders, lack of proper exercise, especially of shoulders. Precautions: avoid wearing tight-fitting clothes, avoid to sit on improper furniture, don't sit, walk or stand in bent position. Note: a person suffering from kyphosis will definitely lead to round shoulders problem. Hold the horizontal bar for some time. Chakrasana, Dhanursana. Keep tip of fingers on your shoulders and encircle your elbows clockwise and anti-clockwise direction. Lordosis. inward curvature of spine in the lumbar region beyond the normal level. It results in hollow back, causes habit of walking with belly protruding in younger age, not doing exercise, overeating, women giving birth to many children, improper development of children, improper environment. Precautions: obesity should be checked, and overeating should be avoided. Keep body straight while carrying weight. Take balanced diet. Corrective remedial measures for lordosis. Boat pose: Navasana, alternate toe touching, perform Paschimottanasana, forward bending, perform sit-ups regularly, Halasana, regularly stand straight and touch your feet. Kyphosis: excessive outward curvature of mid-spine in the thoracic region, causing hunching of the back. It is an abnormal increase in the flexion of the spine, causes reading in dim light, malnutrition, wearing tight and shapeless clothes, carrying heavy load on shoulders, habit of bending while walking, unsuitable furniture, weak muscles, habit of doing work by leaning forward. Corrective remedial measures for kyphosis. Perform Dhanusana, Bhujangasana and Chakrasana regularly. Bend your head backward in standing position. Reverse sit-up: always keep a pillow under your back. While sleeping, sit on a chair and stretch your hands back to give a good stretch on shoulders. Backstroke swimming: reverse bending on Swiss ball, cat pose and camel pose. Sideways curvature of the thoracic region of spine in C or S shape. It majorly occurs during growth spurt before puberty. It causes one shoulder down and one is raised up. Causes diseases in the joints of bones, underdeveloped legs. This is seen in people with cerebral palsy or having partial paralysis. Rickets due to carrying heavy loads on one shoulder. Unhealthy conditions like inadequate lighting arrangement, unsuitable furniture, partial deafness. Precautions: balanced diet should be taken. Standing should be avoided in sideways bending position. Avoid walking for the long time while carrying weight in one hand. Corrective remedial measures for scoliosis. Bending exercises should be done on the opposite side of the C-shaped curve. Hold the horizontal bar with hands and hang for some time, and also swing body from left to right side. Perform breaststroke swimming technique. Lie down in prone position and raise one hand and opposite leg from the hip. Osteoporosis refers to decreased bone mineral density. It is a skeletal disorder. A healthy athlete who practices physical activity and weight-bearing exercises will have higher bone mineral density in comparison to others. Factors which lead to osteoporosis among women athletes are: A. Insufficient calcium in the diet. B. Amenorrhea. C. Eating disorders. Eating disorder is a mental illness which causes disturbance of an individual's regular diet. In simple words, when people began to eat more than normal or very small amounts, it is known as eating disorders. It is a range of psychological disorder in which a person's eating behavior is abnormal. It may include inadequate or excessive food intake which can ultimately harm an individual well-being. There are two types of eating disorders: anorexia nervosa, bulimia nervosa. It is the first menstrual bleeding that a young girl has and is a central event of female puberty. It occurs approximately at the age of 12 years. However, it can happen early as 9 years or as late as during 16 years of age. Menstrual dysfunction: it is a disorder or irregularity in women's menstrual cycle. In other words, it can be defined as abnormal bleeding during the menstrual cycle in women. Amenorrhea: it is a menstrual disorder or illness in females of 18 years and above either never begin menstruation or absence of menstruations for 3 or more months. Amenorrhea can also be defined as the cessation of women's menstrual cycle for more than 3 months or more. Two types: primary amenorrhea and secondary amenorrhea. The various factors which lead to amenorrhea among women athletes are: A. Hormonal changes. B. Intensive exercises. C. Intake of less calories. Female athlete triad means a syndrome in which osteoporosis, amenorrhea and eating disorders are present in the female. The triad is a serious disorder or illness with lifelong health consequences and can be very fatal. If a woman athlete is suffering from any one condition of the triad, it is likely that she may be suffering from the other two conditions of the triad. Symptoms of triad: fatigue, frequent injuries, loss of endurance power, irritability, increased healing time for injuries, enhanced chances of fracture, cessation of menstruation, low self-esteem. Female athlete triad. Eating disorders: amenorrhea, osteoporosis. Participation in sports during menstruation could be physiologically harmful. Recent studies says that no basis evidence of dysmenorrhea, painful menstruation, as a result of intensive participation in sports. Absence of menstruation in women. WHO train for long duration in running. It is not applicable for all the women sports persons. Therefore, sports participation is beneficial in relieving pain and preventing dysmenorrhea. Any effect on sports performance during the phase of menstrual cycle? Totally not true, because international records have been set in all the stages of menstrual cycle.